Hi, this is Eric Fitzsimmons with Living Beyond Breast Cancer. We're here at ASCO 2019. I'm here with Dr. Adam Brufsky from University of Pittsburgh Medical Center. Dr. Brufsky, thanks for coming on.
Thanks for having me.
So what are you excited to see this week?
Well, in breast cancer, there's a lot of really cool stuff, especially in metastatic disease. I think that the Mona Lisa 7 trial, which in young women with breast cancer who have estrogen receptor positive breast cancer, if they get a combination of an LHRH agonist like Lupron or Zoladex with an aromatase inhibitor like letrozole, and they add ribociclib, which is CDK4/6 inhibitor, the combination of the three actually has an overall survival benefit, and a substantial one. So this is really the first time that these drugs actually improve people's survival in ER-positive metastatic breast cancer. It's very exciting data. So that's number one. I think that some of the other things that are happening are in HER2-positive breast cancer. We're going to have a lot of data on what happens. Most people who have HER2-positive metastatic breast cancer will get, say, paclitaxel, trastuzumab, and pertuzumab. Then they get Kadcyla, which is TDM1. And what do we do with them afterwards? And so we have a lot of really interesting data. We have a drug called margetuximab, which actually is kind of a derivative of trastuzumab that actually has more immunogenicity, and it's actually a very fascinating molecule. There seems to be a survival benefit when you give it with chemotherapy in third line and beyond. We also have some data on HER2 tyrosine kinases, which are oral drugs that get through the blood-brain barrier. We have some very interesting data on neratinib when combined with capecitabine. Seems to be better than lapatinib and capecitabine in terms of people's overall progression-free survival, as well as their overall survival. And the really neat thing is that it reduces the incidence of symptomatic brain metastases. So that's really interesting, because I think that's the biggest problem in HER2-positive metastatic disease, is really the development of brain mets. And if we can do anything to prevent that, that's really exciting. So there's some really cool stuff. I mean, there's some other stuff about, for early stage breast cancer, how to use the 21 gene assay Oncotype better.
Right.
So we're actually incorporating clinical risk into that equation now. Okay. So there's some really interesting stuff out there that I really like.
Great, that's fantastic.
You're welcome.
Thanks, Dr. Brufsky, for coming on. You can keep up with all the breast cancer news updates from this year's meeting at lbbc.org/ASCO 2019.